Hello, my name is Cecilia Johansson and I am a medical doctor at the Skellefteå Research Unit affiliated with Umeå University in northern Sweden. Together with my colleagues Erik Dahlqvist, Jonas Andersson, Jan-Håkan Jansson and Lars Johansson, I have performed a study on incident atrial fibrillation including atrial flutter. Our study is called Incidence, Type of Atrial Fibrillation and Risk Factors for Stroke, a population-based cohort study. The aim of our study was to estimate the incidence of atrial fibrillation and to assess the presence of provoking factors at the first diagnosed episode of atrial fibrillation. We also aim to assess the presence of risk factors for stroke and systemic embolism, and to determine the type of atrial fibrillation. Our study was performed in 2011 and 2012 in northern Sweden. We used diagnosis registries to identify patients with incident atrial fibrillation. All diagnoses of atrial fibrillation were manually verified. We used medical records to find data on presence of provoking factors at the first diagnosed episode of atrial fibrillation, and to assess the presence of risk factors for stroke and systemic embolism according to the Shadsvask risk score, and to determine the type of atrial fibrillation. We identified 607 patients with incident atrial fibrillation, which gave an incidence of 4 per 1,000 person-years. The incidence increased with age, as you can see in this figure. 1 in 5 patients had a provoking factor present at the first diagnosed episode of atrial fibrillation. 4 in 5 patients had a Shadsvask risk score of 2 or more. 33% had permanent atrial fibrillation, 23% had persistent atrial fibrillation, 20% had paroxysmal atrial fibrillation, and 24% had a single episode of atrial fibrillation. I hope you will find our results interesting. Thank you for your attention.